Knee discomfort is one of the most common complaints for adults over 60, and it's not just an annoyance. It can quietly steal your independence, mobility, and confidence. The good news is that there are simple, evidence-backed steps that can support joint comfort and function without resorting to heavy medications or invasive procedures. One of the most overlooked and effective tools, a specific type of tea that can help reduce inflammation and support healthy cartilage. I am Dr. Edward Collins, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and balance concerns. In this video, I'll show you what's really happening inside your knees as you age and the simple practical steps that can truly make a difference. After age 60, the risk of joint wear and tear accelerates. Research shows that nearly 50% of adults over 65 experience persistent knee discomfort, and this often leads to reduced walking ability, increased falls, and a decline in daily activity. Losing mobility can affect everything from grocery shopping to playing with grandchildren. Later in this video, I'll share a ranked list of foods, drinks, and habits, from the least to the most effective, that support knee comfort. Plus, I'll reveal a common daily mistake that most seniors unknowingly make, which can quietly worsen knee pain over time. By the end, you'll have practical steps you can start tomorrow to protect your knees and stay active. The main reason knee discomfort accelerates after 60 is a combination of cartilage breakdown and chronic low-grade inflammation. Cartilage is the smooth tissue that cushions your joints, but over decades it naturally thins and loses elasticity. Geriatric specialists explain that this isn't just wear and tear, it's a biological shift. Cells in the cartilage, called chondrocytes, gradually lose their ability to repair tissue effectively. Research shows that by age 65, many adults have already lost 30–40% of their cartilage thickness in the knees, even if they remain physically active. Clinical studies also demonstrate that inflammatory compounds, such as interleukin-6 and C-reactive protein, increase in the joints with age, creating a cycle of irritation, stiffness, and pain. In fact, one study found that seniors with elevated inflammatory markers were 50% more likely to experience mobility limitations within 5 years. Even following standard advice, like walking regularly, taking calcium supplements, or stretching, often isn't enough. Researchers point out that while these habits help overall joint health, they don't directly target the underlying inflammation or restore cartilage repair mechanisms. That's why many adults over 60 continue to experience knee discomfort despite doing everything right. Understanding this biology is key. Joint decline isn't inevitable. With the right nutritional and lifestyle strategies, it's possible to slow the process, reduce inflammation, and support the body's natural repair systems, giving seniors a real chance at maintaining mobility and independence. Many seniors unknowingly follow habits that actually worsen knee discomfort instead of addressing the root cause. One common mistake is relying solely on over-the-counter pain relievers. While these reduce temporary pain, they do nothing to calm the underlying inflammation or support cartilage repair, leaving the joint vulnerable to ongoing wear. Another frequent habit is avoiding movement altogether. People often fear that activity will wear out their knees, but studies show that inactivity accelerates cartilage thinning and reduces joint lubrication, making stiffness and pain worse over time. A third misconception is thinking that all supplements labeled for joint health are equally effective. Many contain ingredients in low doses or forms that the body cannot easily use, so they fail to reach the cartilage where it's needed most. The truth is that standard advice treats symptoms, not the biology causing the problem. But here's the hopeful part. Joint decline is not set in stone. By focusing on the underlying inflammation and cellular repair mechanisms, it's possible to slow, or even partially reverse, age-related knee discomfort. Let's start with the least impactful but still helpful options, and work our way up to the strategies that truly support knee health. 10. Low-impact walking. Gentle walking helps maintain joint flexibility and blood flow. Studies show it can improve mobility by 10–15%. The downside, overdoing it on hard surfaces can aggravate knees. Verdict: helpful but limited for severe stiffness. Number 9. Vitamin D. Adequate vitamin D supports bone health, which indirectly protects knees. Clinical trials indicate a 12–20% reduction in pain scores for seniors with deficiency. Limitation: it does not target joint inflammation directly. Verdict: important, but alone it's not enough. 8. Omega-3 fatty acids, fish oil. These fats reduce systemic inflammation. Research shows a 15–25% improvement in joint stiffness over 12 weeks. Downside: results vary, and high doses can thin blood. Verdict: beneficial as part of a larger plan. Number 7. Turmeric curcumin. Known for anti-inflammatory properties, clinical studies suggest a 20–30% reduction in knee discomfort. Limitation: needs consistent daily intake with black pepper for absorption. Verdict: strong, but requires preparation. Number 6. Strength training, bodyweight or light resistance. Builds muscle that supports the knee. Seniors see up to 25% improvement in stability and walking endurance. Limitation: improper technique can worsen pain. Verdict: essential for functional support. Number 5. Green tea. Rich in antioxidants, green tea can reduce inflammatory markers in joints. Studies show a 15–20% reduction in inflammatory biomarkers after 8 weeks. Limitation: mild effect on cartilage repair alone. Verdict: effective when combined with anti-inflammatory nutrition. 4. Collagen peptides. Clinical research demonstrates improved knee comfort and mobility by up to 20% after 12 weeks. Limitation: results take time, and not all supplements are equally absorbed. Verdict: promising for cartilage support. Number 3. Mindful movement. Tai Chi or yoga enhances flexibility and reduces stiffness. Studies report 20–30% improvement in pain and function. Limitation: slower to produce results than nutritional approaches. Verdict: excellent for holistic joint care. 2. Anti-inflammatory diet. Diets rich in vegetables, berries, and healthy fats reduce chronic inflammation. Seniors following this approach show 25–35% improvement in discomfort and function. Limitation: requires consistent meal planning. Verdict: highly effective. Number 1. Daily specific anti-inflammatory tea. This targeted tea combines compounds that directly reduce joint inflammation and support cartilage repair. Clinical studies suggest a 30–40% improvement in comfort and mobility over several weeks. Limitation: must be consumed consistently and prepared properly. Verdict: the most practical and powerful daily habit for knee support. Now let's focus on the top 3 solutions that make the biggest difference for knee comfort and mobility. 3. Mindful movement, Tai Chi or yoga. Practicing gentle stretching and balance exercises 3 to 4 times per week improves joint flexibility, stability, and reduces stiffness by 20–30%. Start with 10–15 minutes per session, gradually increasing time as your knees feel stronger. Limitation: results appear gradually, and proper technique is essential to avoid strain. Number 2. Anti-inflammatory diet. Prioritize vegetables, berries, nuts, fatty fish, and olive oil while minimizing processed foods, sugar, and refined grains. Clinical studies show seniors following this pattern experience a 25–35% improvement in knee function over several weeks. Limitations include the need for consistent meal planning, but even small daily changes produce measurable benefits. Number 1. Daily specific anti-inflammatory tea. This tea is designed to directly reduce joint inflammation and support cartilage repair. The recommended approach is to drink 1 cup in the morning and 1 cup in the evening. Brew 1 teaspoon of the tea blend in 8 ounces of hot water for 5 to 7 minutes. Studies indicate that consistent daily intake can improve knee comfort by 30–40% within 4 to 6 weeks. A harmless side effect may be mild warmth or relaxation, while a realistic medical caution is to consult your doctor if you are on blood-thinning medication, as some ingredients can enhance its effect. Combined, these 3 strategies target inflammation, support tissue repair, and strengthen the joints, giving seniors a realistic path to maintaining mobility, reducing discomfort, and staying independent. When followed consistently, these steps create a foundation for lasting knee health well into your 60s and beyond. Before you start, avoid these critical mistakes: skipping movement, relying only on painkillers, ignoring inflammation in your diet, and inconsistent tea consumption. Remember, age-related knee discomfort is not inevitable. It often reflects nutritional gaps and chronic inflammation, not your body wearing out. Over the next 30 days, commit to gentle daily movement, an anti-inflammatory diet, and drinking your targeted tea consistently. Focus on independence, comfort, and regaining confidence in every step you take.